Disclaimer: the views, opinions, and insinuations made by the host or guests do not reflect those of the show, the management, and the network. Viewer discretion is advised.
Hello, everyone. This is Master Coach Hasmin. I am a registered medical technologist, and right now I am a marketing executive in Lifeline Diagnostic Supplies, and I am a certified CACC life and mental health coach. I am also a tribe builder, and I am the founder and creator of Life's Labyrinth coaching community. And tonight you are joining me today for another episode of When Sickness Matters here in our digital space, Ting Talk Broadcast. And Ting Talk Broadcast is a flagship community project of speakers of coaching Ting Talk from Life Coach Philippines and members of Coach A coaching community. And our mission is to get closer to our kindred and serve better our coaching tribe. And we envision to be the go to network for content that connects the mind, the heart, and the soul through the platform of life coaching. And this is us in the Philippines advancing coaching as an art, science, lifestyle, profession, and a business. And your one coaching thought for today is current, and no matter how bad it is your health today, you cannot stay with whatever is current. And we'll be back shortly. Welcome back, and today is 8th of May in the year of 2022, and it's a beautiful Sunday evening. And right now, I am broadcasting beyond borders of San Mateo Rizal, first class municipality in the province of Rizal. And you are joining me for another episode of When Sickness Matters. And this program is created for all the individuals who are ready to take action towards healing and prevention of sickness from coming to you, from coming to your family and to your loved ones. And this coaching conversation is all about prevention is better than cure. Every week you will be meeting medical doctors, medical professionals, and we will ask them on how to break the bias on the medical services that they offer and how we can bridge the gap of healthcare and healing to the people. And my guest for tonight is from Region 8 or Moc City. He is Dr. Eric Romero and he practices urology. He treats patients at OSPA Farmers Medical Center in Ormoc City and other clinics, okay, in Region 8. He is a very successful man, a business person, husband and a father of three beautiful children, a man of honor, integrity, hardworking, compassionate physician, and that is according to his sister. And let's get to know him tonight. Let's get to know him better and understand how he maintains a work life balance despite his busyness and his heart of helping the Filipino patients in Region 8 and getting healed and living a quality life. So let's all welcome Dr. Eric Romero.
Hello, good evening.
Hello, Doc. Good evening. So, batiin po natin no, yung ating mga nanonood. So, let them know where are you coming from right now.
Good evening, everyone. Happy Mother's Day. And I'm Dr. Eric Romero from Ormoc City here in Region 8.
Yan. So Doc Romero is from Region 8, yes. And to all the viewers right now, those who are watching us, all the mothers who are watching us right now. So happy Mother's Day. So how
Happy
was your
Mother's Day.
Mother's Day? So how did you celebrate Mother's Day today. So let us know in the comment box, and if there is someone that you wanted to greet, no, so you can greet them, you can tag them in the chat box so that they can greet them, no. So pwede niyo po silang batiin right now in the comment box, greet them, give them some inspiring message, and give them some um encouragement, no. So it's also good that the mothers will be able to join us today in our discussion. And Doc Eric here is actually a urologist, and he 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 did a lot of activities, no. Maraming ginawa si Doc, no. So as an advocacy, and at the same time in what he do in his profession. So tonight, no, so let's learn about our kidney, no. So and men's health as well. So as a urologist, he caters on men's health, particularly dun sa kidney, no, and also prostate, no. So let's get to know more about that health, no, so kidney and prostate health. And Doc, tell us what you do right now and what are the current challenges, no. So in your medical field, in your medical area, what are the current challenges and what are you doing right now?
Okay. Thank you, Coach. Again, I'm Dr. Eric Romero, a urologist here in Ormoc City. A urologist does treat any patient, whether male or female, anyone with diseases in the urinary system. That includes the kidneys, the ureters, the urinary bladder, the prostate, men's health, and also including sexually transmitted diseases, including also erectile dysfunction. Now, anything that pertains to men's health, they usually should go and visit a urologist. Urologists also do surgeries in anything with mass or cancer in the kidney, the ureters, or the urinary bladder, including the prostate as well.
Yeah, so that's what Doc urologists do, ano. So as you have heard, Doc, di ba? So I've read in the I did a few research, ano. Sabi po nila dito sa atin here in the Philippines, kidney disease, especially the end stage renal disease, is already the seventh leading cause of death among the Filipino people. So, and based on the statistics, one Filipino develops chronic renal failure every hour, about one and or about 120 Filipinos per million population per year, no. So let me know your thoughts on this, Doc. So why is it that right now yung kidney disease is, especially the end stage renal disease, is now nagiging seventh leading cause of death na siya here in the Philippines?
Uh, by the way, Coach, I am. There is also another specialty, which is a nephrologist, who
Oh.
does the treatment of the medical condition of the kidney. They are
Mm-mm.
the ones who do the hemodialysis if the patient is having renal failure.
Mm.
In my practice as a urologist, we do renal failure or end-stage renal disease may come. There are a lot of causes that would probably cause or possible causes for end-stage renal disease. Either it can be hereditary or yes, it can be inherited, meaning to say once you have the family and it can be inherited to the next generation until such time that the kidney will eventually fail and will need either a hemodialysis and or kidney transplant. In my practice, there are possible causes as well, like the kidney stones. These are the number one cause of renal failure, especially if we if we continue eating food rich in salts, no? Mahili kasi tayo, we are in a tropical nation. So, there are a lot of mga isda na mga bawal or pagkain na gusto-gusto natin, no? And then mahilig tayo sa mga asin. Then we love to eat salty foods, and because of the heat of the sun, there is also dehydration that can cause eventually can impair or damage the kidneys. So these are some of the factors that we eventually end up to end stage renal disease.
Mm. Yeah, no? So, tama ka dyan, Doc, ano? So, in fact, medyo guilty ako dyan, ano? So, medyo mahilig tayo sa maaalat. And I think, if you will notice, no? Filipinos loves yung may mga sausawan sila, no, Doc?
Yeah,
So,
exactly.
yung mga, when you eat fish, parang everything, no? So, parang kailangan ng mga Filipino people ay may sausawan sila. And that is, one of the cause, no? So, ng
Yeah,
mga
diet is one.
diet. Mm. Diet is one, and it has also to do something about yung pagiging tropical country din natin, Doc.
Yeah, kasi mainit dito sa Pilipinas, no? Tapos mahilig tayo pag kumain tayo, hindi mawawala yung betsin, hindi mawawala si mga seasonings. Aside from salt, we use other, ano ba to? I'm also guilty of using, I don't want to mention, no, yung mga nilalagay natin ng mga seasoning na pampasarap, mas lalong mas masarap, no? And then after that, meron pa tayong at the side, meron pa tayong uh, mga sausawan na
Mm.
gusto natin na hindi mawawala. Everyday may toyo patis tayo nakasama.
Mm.
Halos
Yeah,
inumin na lang natin yung toyo at saka patis kasi part na yan, lalo na kung may sili.
true,
And
no?
then next, and then second, bihirang-bihira or less naman ang water intake natin. So it adds injury, no? So sa kidneys natin. Then na damage yung mga kidneys, no? And also, yung umuuso kasi ngayon yung mga uh, herbal medicines, no? Sometimes naglalabasan kaliwat kanan. May mga herbal medicines, sometimes they would just try to say that is be FAD approved or approved nung kung saan-saan, not knowing what is the real content of that herbal medicine. I have nothing against them, no? I have nothing against them. But sometimes we Filipinos would love to it's either beautification, it's either something would say that is good for your health, but sometimes instead of being good to our health, they became source, no, or the reason, damaging not only the kidneys but other parts of our body.
Yeah. So it's good that you are able to mention that, Doc, ano. So tama naman, ano. So we believe in yung mga herbal medicine, but it's also good that it is FDA approved, no? Yung ating mga
Yes.
ng local FDA approved siya. So don't just consume, no? So anything na sinabing herbal siya, because sabi mo nga it can also affect or damage our kidney, no? So hindi dahil herbal siya, we should start also taking that. So it's also good that we check on the label, we check on if it is FDA approved. Especially, Doc, no, kung meron ka na ring medyo nagsasuffer na rin yung kidney mo. Tama
Yeah.
po ba?
Yes.
Yeah, it's good to consult with the medical professional. It's good to consult with the doctor. So baka mas maging maka-harm pa siya, no? So may tanong po dito, Doc, ano? So in terms based on your experience for how many years, ano? So ano na ba yung age ngayon, no, na nagsisik na sila ng urology care?
Oh, di naman ala, no. The youngest I have is around 8 years old or 10.
Oh.
No, because of kidney stones. Yes, it happens. The oldest, of course, urologists. We are known for geriatric patients, elderly patients like men who are having difficulty in urination. So the youngest sa bato sa kidney, yeah, I have 8 years old. An 8-year-old boy. Yun, dinadala sa clinic, ultrasound findings na meron ng bato. So as early as that, nagkakaroon na.
Yeah, and that is because of diet, no? So, 8
Yes.
to 10 years old, probably to all the parents who are watching us right now. So, as early as 8 to 10 years old, pwede nang mag-develop ng kidney stone yung mga bata, ano? And this could be brought about by yung mga chips, Doc, no? Pwede yun, no?
Exactly. Yun ang mas paborito nila maalat eh. Mas
Mm-mm.
mabilis mabili. Umiiyak yung anak, kaya kumain ng pagkain na healthy food. Supposedly, you should be eating, these kids are growing, no? So they should learn how to eat the nutritious foods. But instead, binibigyan natin, magulang din ang nagbibigay or kapatid, pinsan, or may mga tindahan daw kasi sila. Didiretso lang kukuha sa sari-sari store nila. ayun,
Mm.
kinakain na nila yung mga chichirya, which we know will affect the kidneys of these young kids.
Yeah. So that can be very alarming, you know. So sometimes akala natin dahil bata pa naman 'yan, no? So
Yeah,
pwede pa yang kumain, kaya pa yan ng body nila. And not only that, doc, I also noticed that may factor din po ba 'yon, yung mga processed food like
oh,
noodles,
yes, oh, of course, yeah.
So isa din
Mahilig
'yon.
tayo diyan, eh, mga instant foods.
Mm. And salt is a very good preservative, right?
Yeah,
So kaya high content talaga, high salt content talaga tong mga nako-consume natin, ano. So yeah, it starts, no, sabi nga ni Doc, and since si Doc pa lang 'yon, no. So meron na siyang 8 to 10 years old. At anong nangyari doon, Doc? Inoperahan ba 'yon or nakuha ng medication?
yeah, there are stones, especially if they are being, uh, nakikita mo na sila na medyo maliit pa. So, there are stones that can be dissolved by medications. Others, if they cannot be dissolved, there are certain procedures that you don't that may we can do, not necessarily to do and perform surgery, not unless the stone is too big, no? Hindi na siya kayang ma-dissolve or hindi na siya kayang ma like we do shockwave lithotripsy if the stones are still manageable. So in this age, we remind these parents as well the kid, if the kid is able to understand, that he or she should be able to know his health, no? That because once a stone former will always be a stone former until you grow old. Pag nandyan na yan, wala na. May forever sa bato.
Yeah. So you mentioned about that because that's what I'm going to ask next, ano? Kasi because my husband, Doc, is naoperahan na siya sa kidney, no? So the stones were already blocking his urinary tract, so that
Mhm.
he has to go through operation. So yung may maliliit na butas, ano? So at hindi rin kinaya ng yung another procedure, yung sinasabi mo nga po na shockwave, because nakabara na siya doon sa urinary tract, ano. So and you mentioned once a stone former is a stone former at may forever sa
Will
bato.
always be. Yeah, will
Mm,
always be a stone former. Hanggang sa
mm,
pagtanda mo na yan. Pabalik na balik na lang yan. We don't know when it will happen again, but yes, babalik. There is always recurrence of stone. Especially sometimes if you're good. No, we feel good, we feel we're better. So okay na yan. Ang usual kasi natin sinasabi, konti lang naman eh.
yeah.
Kakaunti lang naman yung kinuha kong ganito. Kakaunti lang naman yung kinain kong ganito. Eh syempre, the foods that we have to avoid, masarap ang shrimps, no, crabs. Those are our favorites, seafoods. We love seafoods, but somehow they are rich in uric acid. So these are the foods, no, that can cause recurrence of stone formation. Peanuts, we love to eat peanuts. We love to eat mongo, no, and then people love to eat tuna, no, tuna either kung ano nung luto, pwede mo siyang ihaw, pwede rin siyang fresh. You can eat it raw, no. So these foods they are rich in uric acid and they can cause recurrence of stone formation. So we have to be careful if a person is already a stone former and then you undergo surgery after 2 or 3 years again. There you go again. You have the stone. So don't tell me, uh, begging me and then telling me that asking me. Some patients asking if there are other methods or ways that they will not undergo surgery. Yes, there are some, but lucky for those people who can just pass out the stones or who can just be dissolved. But for some, unfortunately, gaya ng sinabi mo, your husband has to undergo certain procedures just to remove such stones blocking the kidney. Because if these obstructions are not removed, these are the ones that will end up into end-stage renal disease. So the dictum for us is to save as much as nephron as to save much as much nephron, no? Hindi natin kailangan na sana hindi na tayo aabot doon sa end-stage renal disease.
Yeah, no? So, as you mentioned, stages siya, no? So, hindi ka naman talaga aabot sa end-stage renal disease if you start um, taking care of that, no? So, ano
Yeah.
po ba, Doc? Okay, when do we consult, no? So, when do we start to go for a checkup for to check on our kidney, for to check on urologist? Kailan siya dapat gawin?
Kung kidneys, well, most of the ang ano ngayon, ang mga offices, no, or certain companies, you already have your healthcare. Sometimes they have their HMO. So if there's a chance for you to include your at least man lang, no, an ultrasound of your whole abdomen or the kidney, urine, and the bladder, or the kidney and urinary bladder, just as simple ultrasound on the urinalysis will do. No, especially for those who have already and who are known stone formers. No, so these are some of the basic checkup or laboratory examinations that we should need at least somehow for us to be able to know and to have an early diagnosis for such diseases.
Ayun. So to all our viewers right now, no? So as early as now, you can start having your self-check, no? So kung wala po tayong card for right now sa employment natin, if you're a business person, no? So it's good to have an annual check-up, no? So
Yeah,
as urinalysis, doc, pwede na yon. As
yeah,
simple
pwede
as
na yun.
urinalysis, pwede na
Yes,
yon,
simple
no?
urinalysis, yes.
Mm. So iihi ka lang and then have it checked. So that's very hindi siya expensive na test, but it's a good
80
way.
pesos, I think,
Yeah, less than 100 pesos, depende pa doon sa
laboratory.
laboratory. Oo, na pagche-checkan mo, no? So start with you can start it with urinalysis for you to be able to check kung may mga crystals diyan, ano? So kung may
Yeah,
mga WBC, no?
RBC, yeah, red
RBC,
blood cells,
red blood cells. So
fast
those
cells,
are
yeah,
fast cells. So those are the start of a possible infection, no? May tinatawag silang UTI, no? So doc,
yeah.
yan ang very common, no, na nakikita sa mga Filipino. So doon unang-unang nagsa-start, no? So ano po ba yung nagiging cause ng urinary tract infection so or UTI?
Well, it depends, no, if we're talking about male or female. Pag female kasi, sa mga babae sa inyo, you have a very short urethra. And females are prone of, are usually, you use a lot of napkins. It's either a panty liner, yung natural na napkin, no? And you have your regular menstrual cycle. And if the female starts to have her menopause and an elderly, the hormone, no, your normal vaginal uh, what you call this one, inyong normal na secretions, no, nababawasan din yan, and they become a good nidus, no, for bacterial uh, accumulation, and then nagkakaroon naman ng urinary tract infection. For some, of course, next is hygiene. Although ang mga babae, no, there are a lot of females sobrang linis that they always, it's either they use feminine wash. There's nothing wrong about it, but too much cleaning or douching, especially douching, yan, nawawala na yung normal bacterial flora niya, no? So nagkakaroon siya ng, nagiging area siya na ngayon ng accumulation of bacteria, and will start to bacterial infection. For men, well, depende yan. If a male person is a sexually active person, it can cause you sexually transmitted diseases. Others, both male and female, can have also urinary tract infection because of like a presence of kidney stones, urinary bladder stones, or other factors, you know. And yung iba naman, siyempre, kakain ka ng mga chichirya, nakukulangan ng tubig, no? So these are some of the common factors that can probably cause urinary tract infection.
Ayun naman pala, no? So, hindi naman pala lahat because of the food that we eat, no? So, as we
Yeah.
heard it from Doc that it can be a bacterial infection. Kaya tayo nagkaka-UTI. But yung pag-bacterial infection, Doc, it may develop into stones then.
Hindi naman, hindi. Pero yung
Mm.
stones, they have certain bacteria inside the stones that can cause urinary tract infection,
Okay.
recurrent urinary tract infection.
So, that's
Pag,
why. So,
pag men naman, no, pag lalaki naman, elderly male, so because of difficulty in urination, there's stasis of urine inside the urinary bladder, hindi lahat ng ihi naubos, no? naiipon yung ihi o nag-aabot yung and all the naihi, no? So because of the enlargement of the prostate gland. So because of the macho effect ng mga Filipino guys, no, or Filipino mga lolo natin, ayaw munang magpakonsulta na talas hirap na talagang umihi.
Yeah. And you mentioned about prostrate, doc, ano? So, i-shift natin ngayon yan. So, from kidney to prostrate. So, can we educate all our listeners right now so on the importance of why we also need to have, for especially for men, to have our prostate check?
Oh, ang prostate no is sa lalaki lang yan na or na makikita. It is kung tinatanong nila, Doc, ano ba ang function ng prostate? Ang prostate is kumbaga sa aquarium, hindi makakalangoy ang isda kung walang tubig. So the prostate produces the seminal fluid in order for our semen to uh, maka-flow no, ng maayos. Now, in some persons, the prostate enlarges. The normal prostate gland is about 20 grams. It's maliit lang siya. Pero may mga elderly or lolo tayo na lumalaki siya ng todo. Sobra, no? May iba, 100 or more. So nahihirapan umihi. Kailan ba tayo kailangan mag-start magpakonsulta sa isang urologist with regards to our prostate cancer, with our prostate? Well, if a person ages 40 years old and above, mas maganda po, no? You will start your visit to a urologist, especially if there is a family history of prostate cancer. Why? Prostate cancer, kung mahuhuli natin siya at an early stage, like stage 1, it is curative. Ibig sabihin, hindi sila magki-chemotherapy or mag-radiation therapy for as long as they will undergo either total removal of the prostate gland or other factors like brachytherapy. No? So, again, as you have mentioned before, yan, no? Early diagnosis is better than cure.
Yes. Yeah. So, okay. So, to all our viewers right now who have just tuned in, so we are talking to Dr. Eric Romero. So, he is a urologist, and we're talking about here about renal care and prostate care. So, to all men who are watching, and if kung yung mga wife here or yung mga anak here, yeah, for men, no, you start having your prostate check at the age of 40. Sabi nga ni Doc, ano, so it's easier to catch, no? So it's easy, the earlier that we catch if there is something wrong, so if there's an early stage of cancer, which is very common, Doc, ano, ang prostate cancer. So,
Isa siya sa mga binabantayan sa lalaki. Kung sa babae, may breast cancer or, di ba, October, you
yeah.
celebrate breast cancer awareness. So, sa lalaki naman, on the third Saturday of June, so that would be next month, that is before Father's Day, with our society, the Filipino Medical Association, has a trust to educate also men awareness regarding prostate cancer.
Yun, that is truly important. So, pag nag-age 40 ka, that should be part of your medical check-up, can be annual check-up, ano? So, meron ka ng urinalysis, no? So, to all our men and women, no? So, it's good to have your self-check every year with urinalysis or every 6 months if it is possible. Total, ano naman yan? Very less expensive test lang yan. So, in any laboratory, you can just go there and just urinate and then have your urine check, no? So, lalo na kapag ikaw po ay mahilig sa mga salty food. Ayan. So, yung mga guilty dyan right now sa mga salty food. So, have yourself check as simple as urinalysis, no? So, and then, for all the men who are watching, no? So, and all the female who are watching, yung mga husband po natin or our parents, no? Or our siblings, it's also good for them, no? So, na pa-check up po. Part of the annual check-up is the prostate, no? So, ano po bang test yung nire-request, Doc, for prostate?
For prostate, well, an ultrasound will do, no? To include the prostate gland, I usually ask the ultrasoundologist to measure the pre and the post void study, no, and then blood examination. If a patient is high risk for prostate cancer, so pinasama natin yung prostate specific antigen sa laboratory examination. And most importantly, you see your urologist and a patient, yung lalaki, they should undergo digital rectal examination in order for us to be able to feel that the consistency, kung ito ba ay matigas, normal ang prostate niya through rectal examination. And then we
Okay.
collaborate the laboratory examination with our physical examination and recommend if he needs a treatment or okay lang kung normal naman lahat edi walang problema.
Yeah. And yun, so sabi nga ni Doc, no, if normal naman lahat, no, so there will be no procedure, then walang problem, no. So, Doc, can we encourage all the listeners right now who are watching us right now to go for that check, no? So, yung um paano natin sila may encourage right now to go for that? What would you like to tell to the viewers?
Sa mga to our male watchers no, kung sa mga hindi lang sa mga lolo, kahit sa mga 40s or 50s. Ang again, ang prostate cancer, if you talk about prostate cancer, wala yang symptoms. You don't have to have any symptoms like difficulty in urination. You will not urinate blood, no? Wala. It has no symptoms. But a patient may have prostate cancer. Lalong-lalo na kung may mga lolo at or kapatid na nagkaroon na ng prostate cancer. But sometimes, now our elderly patients right now don't know also if their parents or if their fathers or their lolos have prostate cancer before because hindi naman siya nagkakaroon ng check-up. Unlike ngayon, medyo health is already readily accessible to everyone. So prostate cancer, again, as I have said earlier, if it nahuli siya ng mas maaga, no, stage 1 prostate cancer, it is curative, no? Meaning to say, it's a big C. Yes, it's a big C. Cancer siya, pero ang kinakatakutan kasi ng marami is ang chemotherapy or radiation. Sa prostate cancer, wala. So kung mahuli siya ng mas maaga, in just a simple rectal examination or just a simple PSA, and the patient underwent biopsy, then curative siya. So gagaling ang pasyente. Pero kung hihintayin natin na doon pa tayo, kung iihi na tayo ng dugo, doon na tayo magpapakonsulta kung hirap na tayong umihi, then that would be a late stage. Kasi pag may symptoms na nananakit yung mga buto mo or nahirapan na umihi, meaning to say already probably the late stage, no? Mahirapan na tayong habulin or yung treatment process.
Yeah. So you've heard it from Doc Eric, ano? So always and always prevention is better than curing. Yes, it may be a big C, no? So but there's nothing to be scared of. I know na sa salita pa lang na big C medyo nakakatakot na, no? But
Yeah.
the earlier that it would be detected, there's a big chance, no, na it can be cured and it can be and you can get well, ano? So kaya nga that's why we encourage you here in When Sickness Matters that you don't have to really wait for na maging malala siya or you get diagnosed, ano, with that. So all you need to do is to have yourself checked, you know, once a year. And as yun, yung sabi nga ni Doc kanina, 'di ba, yung ultrasound, no? So painless naman yung ultrasound, hindi siya mararamdaman, ano. So but it's good, no, for you to all the men who are watching, no, na ipa-check po natin, and to all the men and women, no, so to go to for your kidney, to take care of your kidneys, to have yourself checked in terms of urinalysis, no. So at alam natin that there's a big factor, yung kinakain natin, yung water intake din natin, no. So if you're not into drinking a lot of water as well, no, so medyo may danger din tayo. Medyo may prone din tayo to really develop stones, no? And sabi nga din ni Doc kanina, once a stone former, you'll forever be a stone former. Yan. So kaya lalo pong mag-ingat to. So kung meron po kayong kilala ngayon na who is a stone former, kahit na operahan na po sila, they may develop 2 to 3 years again as stones. So it's important for them to really get to check, to have themselves check, go to the urologist, ano, so para makita po natin, ano, so it's good that that is part of our priority, no? Well, health is wealth. Kailangan priority natin po yung ating health. And if there's a way for us to be able to take care of our kidneys, of our prostate, it's always good to take that into priority, no? So come to think of it, ano, so ano ba yung vision mo sa health mo, no? So maganda na iniisip din po natin 5 years from now, how do you envision your health, no? So the more that we age, nagbabago din kasi yung response yung ng mga organs natin, di ba? So that's why we also need to take care of that. And sabi nga din ni Doc kanina, may mga bata na early stage pa lang, nagde-develop na sila ng stones, no? So because of the diet, because of as parents, no? So let's also watch that out. So that is the first part, no? So we'll be back for a short break, Doc. So medyo magpahinga ka muna, mag ano ka muna, mag-hydrate ka muna, and we'll be back shortly. And my question, so sa pagbabalik po natin, Doc, no? So what is your life outside? Let's get to know Dr. Eric, no? So outside, what he do as a in the medical profession. So what is life outside the hospital? What is life outside Doc Eric Romero's profession? Ayan. So Doc will be answering that after a while. So we'll be back after a short break.
As a business owner, are you overwhelmed by the need to post beautiful, engaging content every single day? Are you left wondering what to write? Tired of scrolling through stock photos that all start to look the same? Confused by complicated graphic design programs? Rise Up Creatives is here to help. Each month, we give you everything you need to create 31 days of social media content in just 5 minutes a day. Customizable captions, curated lifestyle photos, a drag-and-drop graphic design tool, and the ability to post directly to your social media accounts. No one else empowers you with these 4 resources all in one place. Each month, we help you plan your social media calendar by providing you with 31 image themes and customizable captions so you can quickly and easily create engaging content and grow your following. Simply select the image that works best for your feed or story. Then, copy the caption and customize it to fit your audience. 5 minutes a day. It's that quick. Plus, you'll absolutely love our drag-and-drop graphic design tool. Start from scratch or choose one of our beautiful templates to fit your unique brand. When you're ready to export your design, you can download, email, or post directly to your social media accounts. Here's the truth. Our world needs what you have to offer. Don't let technology or procrastination hold you back. Rise Up Creatives is more than an online resource. We're a community helping you overcome your biggest barriers to reach your greatest goals. We're here to help you rise up and be creative.
Yan. So, and we're back for the second part of When Sickness Matters, fourth broadcast brought to you by Teacup Coffee Republic, the coaching hub of Life Coach Philippines and Rise Up Creatives worldwide, your provider of social commerce turnkey solution. So follow us, okay? So follow us. We have a Facebook page on Rise Up Creative and Teacup Coffee Republic. And of course, if you are not yet a smart holder of the Be Learning e-card and you are still missing all the perks that we enjoy, today is the best time for you to take action. So connect with Coach Roselle through 0917-586-1661 to join the Be Learning Society, the tent maker of the Be Learning Homes for Mental Fitness. So here, if you avail the Be Learning e-card, you enjoy 5% food and beverage discount from Decaf Coffee Republic, and you get a full access to the Mental Model Masterclass by Master Coach A happening every fourth Saturday of the month. Plus, you get to benefit from the 90 minutes free coaching session with senior coaches from Life Coach Philippines. And save the date on May 28th at 7:30 p.m. for our next Mental Model Masterclass, as Master Coach A will teach us about super adapter mental model. So for more information and registration assistance, connect with Coach Roselle at 0917-586-1661. And also, if you are interested to embark on a journey of becoming a professional life coach, Master Coach A offers co-actively co-create life coach certification program with CPD accreditation and with 40 credit units. So life coaching is a 21st century learning experience that is empowering professionals to enhance their skills in multiple domains and thereby increasing their relevance in an increasingly complex workplace. And CACC course includes a 21 days web-based learning, 3 days live coaching bootcamp with Master Coach A, and 3 days live business bootcamp with senior coaching team. And the program package also comes with many other bonuses. So connect with Coach Roselle through 0917-586-1661 to discover the opportunities that is waiting for you in this profession. Ayan. And now call on once again Doc Eric for him to answer yung ating hanging question kanina, 'di ba? So we have seen what Doc Eric has been doing, ano? Pero as a medical professional, ano ba yung life outside his profession, Doc Eric?
Well, ako after work, maybe others may say my life is boring, no? Pero I love to stay home. Good boy. After clinic, after the rounds in the hospital, I don't have any uh, Friday group or Saturday group, they call it, no? So I love to stay home. I spend time with the kids and my wife. I love to eat out, or dine out, or to go someplace where we can just be together as a family.
Yeah.
That's my life after the hospital. So meaning to say, pagka-uwi ko hindi na ako si Doc Eric. I'm the father of three and husband to my wife.
Yun, no? So, yun yung normal life mo, Doc, ano? So, after the
Yun ang
hospital,
routine. Yeah.
routine. So, you go home and then you spend time with your three children and your wife, no? So, hindi ka na
Yeah.
si Doc Eric, you're no longer wearing your white gown and wala ka nang yung mga, or scrub suit, no? So,
Yes.
hindi na yun. So, okay, Doc, no? Bilang medical professional, ano? So, how do you take care of your health, no? Especially, di ba, that at times you were lalo na kung may mga OR ka, 'di ba? That you need to extend long hours to care for people. So papaano ba inaalagaan din ng mga doktor ang kanilang health din?
Personally, no, I know my family history. My mother is a diabetic, no, hypertensive, at kidney transplant, and have to have a pacemaker. So when I age at 40 years old, there I started to have my own annual examination. So hindi ko na hinintay na magkaroon pa ako ng mararamdaman. So basically, it is each and everyone's responsibility and accountability to ourselves per se. And not only to ourselves, because if we have our loved ones, our wife, our kids, we have to stay fit for them, not for us. So I make it a habit that I should go and have an annual examination every year. I usually do it on my birth month.
Mhm.
So it's either after my birthday or before my birthday, for as long as it's within the birth month, I do my routine blood examinations, including to check my ultrasound, and then I do usually treadmill or stress test yearly. In order for me, because I know for sure that my mom is had a heart failure, so conscious na po ako. Conscious na ako to what I eat. I avoid, although hindi pa rin may iwasan yung mga fatty foods, yung mga adobo, pero somehow binabawasan na po. Binabawasan yung maalat because it's a kidney transplant. Meaning to say it's self-awareness, no? We should have this self-awareness. Ano ba ikinimatay ng ating tatay or nanay or lolo, lola? And then you just take it to the present situation. We should stay healthy, not because it is for ourselves, but it is also for our loved ones.
Yeah. Thank you, Doc. Ano? So you've captured the beautiful thing on that, no? So yung sinilensyon mo that yung self-awareness, ano? So
Yes.
sometimes we truly need that. Hindi lang sometimes, dapat all the time yung
Yeah.
self-awareness, ano? Especially in terms of health, how we can start that self-awareness is to go back to your family history, no? So
Yes,
alam mo
exactly.
naman, oo, alam mo naman ano, kung ano yung condition na meron yung parents mo. So
Mhm.
the nearest kin mo, 'di ba? Yung family member mo, so yung mga siblings mo or your parents, no? So titignan mo 'yon siya. And then from there, no? So you start taking care of yourself. And I love what you said, Doc, na sinabi mo that it is our responsibility to take care of ourselves. And that is not the responsibility of anyone else. Tayo yon, no?
Yes,
So tayo
exactly.
yung unang-unang kailangan, ano? So I believe that this is also part of the prevention is better than cure, no? So taking that responsibility that you are responsible for your health. So that's the one thing that I captured, no? So very clearly na walang iba. Not your parents, not your spouse, not your kung ikaw ay anak, no? So or children, no? And not anyone else, but it is you who is responsible for your health. And you can start with tracing back your family history in terms of medical health. And from there, take off from that, no? Kung kunwari kami, ano? So for example, my parents is yun, both sila na hypertensive, no? So I have to really be aware on my blood pressure. I have to really check on it and avoid start avoiding the things that can contribute, no? So na para mailagay ako doon sa sitwasyon na yon, ano? So learn from the past, no? So learn from the medical history. It avails much, no? So if you intentionally pay attention to your family history, and not only that, sabi nga ni Doc, 'di ba, yung may pamilya tayo, 'di ba? So there's a family who waits for us, no? So nag-aantay sa iyo, and they would love to really spend more we would love to really spend more time with them. We want to see, no? Gusto nating makita yung mga apo natin, gusto nating makita yung mga anak natin, 'di ba, na they have a good life. We want to really enjoy then yung mga next generation din natin, ano. So we need to think long game, no? So not only today. Yes, masarap, no? Masarap kumain, Dok, no? So masarap hindi mag-exercise, 'di ba? Pero we have to think very far on where do we want to go? Where do we want to our health to go? And yung good thing yung shinare mo that we need to be responsible. There's no other person that needs to be responsible for our health at tayo lang yan, di ba? Doc, any personal tips? Three personal
May
tips for a healthy
May
life.
may common line kasi ako laging sinasabi sa mga pasyente ko. After I explain their disease entity, their present condition, lagi kong may favorite line. I
Yan.
always
Sige
tell my
po.
patient, the ball is in your hand. It's either you dribble it, you pass it, or you shoot it. Kasi hindi ka naman lahat ng oras masasamahan ng asawa mo, ng nanay mo. Hindi ka lahat ng oras mababantayan ng mahal mo. It is only you who can decide what to do to your life. So again, the health is in your hand. It's either you dribble it, you pass it, or you shoot it. So you may have to take a stand on how are you going to take care of your health, no? And ano nga po yun, yung 3 tips of...
Personal tips mo, Doc, for a healthy life. Coming
well,
from Doc Eric.
number one, of course, pag ikaw may asawa, a happy wife is always a happy life. So number one yun sa tip, wag na wag mo kokontrahin si Mrs. Di ba, ma'am? Ano,
Yeah.
tama po ba ako?
Parang tama yan, Doc. Ano? So, importante kasi yung
Agree, agree.
happiness. Oh, agree.
Opo.
Happiness sa bahay, no?
Lalo na ngayon, it's Mother's Day, so let the queen be the queen today. Ilang oras lang naman eh, pag after 12 midnight, hindi na. Second, drink a lot of water, no? You should take care of your health, including your kidneys, no? By taking a lot of water. They ask me how much water to take in. At least you should be able to urinate. The urine output should always be more than 2 liters a day. No? So kung more than 2 liters ang ihi mo, so meaning to say you should take in more than 2 liters, or we always advocate to take in 3 to 4 liters of water in a day, except at night time, so that you not be spending until dawn na iihi ka ng ihi, no? And thirdly, invest in your health, no? Sometimes sinasabi ng mga pasyente ko, wala akong pera, hirap lang kami, nahirap lang. I like to express and tell them that pag nagkasakit ka, pera din ang gagastusin mo. Pag nasira ang kidneys mo at nag-dialysis ka, pera din ang gagastusin mo. So better now, as an early stage, you should invest. You don't need to spend so much vitamins. You don't need to get a lot of food supplements in order for you to stay healthy. We live in the Philippines na vegetables is mas marami pang sustansya dyan, no? You just have to eat healthy. You just have to choose what you eat and be able to stay fit and healthy. You don't need to go to the gym in order for you to have those beautiful bodies, but you can just jog anywhere, even in your own house. You can make your own platform of exercise, no? For you to stay healthy. There's no excuse. It's not an excuse na wala ko nito, wala ko ganyan, buti pa siya, meron kito ganyan. Unless we try that conviction that we have to stay healthy, and this is not only for us, but for all the loved ones, no? For our loved ones, then nothing is impossible.
Yeah. Those are beautiful tips, no? So something, it is in our hand, no? So talagang with the tips that you have given us, Doc, is truly the ball is in our hands, di ba? So
Yes,
sabi mo kanina,
exactly.
happy life, no? So malaking bagay yan. So because it contributes to our overall mental health, then overall health actually. So because health is not only physical health, but it also includes mental health, ano? Kaya yung masayang bahay, yung masayang pamumuhay, yung happiness is also a good way for us to be healthy, di ba? So, and a happy wife, sabi nga ni Doc, is a happy life, di ba? So, kasama siya dyan, di ba? Pangalawa, yung hydration, di ba? So, tayo ang Pilipinas ay blessed pa, di ba? Yes, although there are purified water that we pay, di ba? Pero kung sa ibang bansa yan, water is truly very, very expensive. But here in the Philippines, it is available, no? So, anuhin natin yan, no? So it's avail natin yung drinking of water, hydration, di ba? So it takes care a lot of our organs, not only our kidney, pero malaking, because we are 70% water, di ba? Yung body natin is 70% water. So kailangan natin yan, di ba? The more we perspire, the more that we urinate, the more tayong mag-replenish ng water natin, no? So to all those who are watching, no? So na hindi mahilig mag-hydrate. So it's about time for you to hydrate. And gusto ko yung sinabi mong third, Doc, is to invest on ourselves, to invest on our health. Go for check-up, no? So prevention is better than cure, and mas costly. Pareho lang po yung magastos, di ba? Kapag ikaw ay nagpa-opera,
Yeah, exactly.
di ba? Pagka nagkasakit ka, magastos din siya, di ba? So why not start now investing into your health in terms of food, no? In terms of exercise, maganda yung sabi ni Doc, so you can create your own platform of doing some exercise, and there's a lot available, no? So sa YouTube, no? Pwede mong sabayan at gayahin, or you walk, no? So jogging, no? So anyway, open na rin naman talaga din ngayon, so you can go to the park, you can go somewhere
Yeah.
and go and jog or bike, di ba? Walk, no? So walk to work, walk during lunch. So make it a priority that you invest on your physical activities as well. And of course, no, at marami pang bagay, di ba? So, hindi lang siya supplement ng supplement. There's a lot of things that we can do, that we can start taking action in terms of investing on our health. Ayan. So, wag lang po tayo mag-invest sa kung saan-saang bagay, di ba? Of course, it's good to invest in the bank. It's good to invest in some of the gadgets or yung mga gusto nating ipamana sa mga anak natin, but the best investment is always to our health, no? So thank you, doc, for that three personal tips, no? So for to have a healthy life, no? Sa mga doktor, doc, no? So particular sa you, personally sa you, what is the challenging part of being a doctor for your friends and to your family?
Challenging part to my friends and family or to the patients?
Being a doctor, no? So being a doctor to your family, no? So ano ba ang challenging part niya?
Of course, because you're the doctor, ikaw lahat ang takbuhan na kahit anong may sakit. The 24 hours, your phone is open, you should be reachable because they run to you for medical advice, even if it is not your field of specialty, but because you are the medical practitioner, the doctor in the family. Ikaw talaga ang tatakbuhan nila. Aasahan nila na tutulong sa kanila in terms of their health condition. So, yun ang biggest challenge, and I believe pinasok ko to, and I believe that this is where God has placed me and to use me in this medical field. So I'm always thankful to Him for giving me this opportunity to serve the God that I serve, no, na maging dito sa medical field na binigyan niyang biyaya sa akin.
Yeah. So that's a good so kasi nga sabi mo nga, doc, no, pag alis mo ng hospital hindi ka na si Doc Eric, no? But the challenging part is minsan nagiging 24/7 doctor ka pa din to your friends and family kasi takbuhan ka. But I love what you said, that you see this as something that God has called you to do, no? So hindi pwedeng hindi ako doktor ngayon because hindi ako naka-time in or hindi ako nakasuot ng aking suit, no, so or aking gown, no. So but it is actually a vocation. So ang pagiging doktor is not only a profession but also as a vocation as well, and a calling from God,
Yeah,
di ba?
exactly.
So hindi lahat ito ay kaya hindi siya para sa lahat, no. So itong profession na to, it is not for all, no. So and very few, no, kaya nga kulang din tayo sa Pilipinas, no, ng mga doktor, no, because only few ang profession na ito, di ba? So thank you for that. So si Coach Marife, yung friend mo, doc, may tanong po siya, what activities relieves your stress, doc?
Relieves my stress. Eating. I love eating, no. Watching movies, Netflix, or basketball, NBA. Yun lang. Madali,
Ayun.
simple lang yung
Mm-hmm. So eating, no? So pag eating, no? And watching Netflix and ano. So you see, no? So yung mga doctors din po natin ay they are normal people and they live a normal life and they just love simple things, di ba? And yet they have a big calling to serve, and that is to serve the Filipino people in terms of health and to give them a quality life, di ba? So bilang doktor, doc, no? Ano ba yung sakit na kinakatakutan mo para sa sarili mo o para sa mga mahal mo sa buhay? What is that sickness that you are afraid of?
Wala naman akong sinasabing kinakatakutan na sakit because I always consider things, no. If it happens, there's always a reason for everything. So all we do is just to trust the Creator. I always tell my patient, I am not God. No, I don't have the magic of somebody, no? Kung sino may magician na yan. And I am not God. Even if they tell me, Doc, I trust you. So, no, don't trust me. Tao lang po ako. You trust the one who is the giver of health. It is Jesus Christ. So, I always direct them the praise. No? Hindi yan sa akin. If gumagaling sila, they thank me, no, you pasalamatan yung Panginoon. Siya yung nagpagaling sa'yo. Ginamit niya lang ako, no? And thankfully na ako na yung biyaya, as I said, the opportunity to serve God through the medical field. It is such a blessing to to be of service to the people, no, to our to the sick and to those who are seeking for help, and lalo na dito sa area ng my specialty.
Yeah. Wow, that's a wonderful message, no? So na we are just instrument, no? Medical
Yes,
doctors are just instrument by God,
instrument.
no? So but it is the
Hindi po ako
ultimate.
magician.
Hindi ka magician, ano? So at ang source pa rin natin is the ultimate healer, which is God,
Yes,
which is
exactly.
Jesus Christ. So we are just an instrument of Him in giving that healing, no? So kaya, pero kailangan talaga ng science and faith, no? So it
Yeah,
goes together. If you want to really experience the miracle healing, and for you to have that quality life, is for you to be able to combine that science of healing and that faith, because that's where miracle happens and begins, no? So ang bilis ng oras, doc, ano? So
yeah.
ang bilis lang, no? So but we have talk a lot, no? So marami tayong napag-usapan, marami tayong natutunan ngayong gabing ito, and we were able to know and see the other side, no, ng ating mga medical professional, ano? So message, doc, ano? So to all our viewers right now, so if you would encapsulate what we have talked about, and from part 1 to part 2, what would be the message that you wanted to leave to the people who are watching and who will be watching this on a replay?
One message I will say is, sinasabi ko rin lagi sa mga pasyente ko, ang katawan natin, ito lang ang puhunan natin. If we are sick, we can no longer work. So if you're sick, you can no longer do what you want to do. If we are sick, we cannot tend or take care of our loved ones. So ang puhunan natin is not the material things that we have, but our health. Ang katawan natin ang puhunan natin. So you take care of your health so that you will be able to take care others, no, that you love, and be able to be responsible, and we will be able to share and enjoy what we call life. So thank you for this opportunity, Coach. And mabilis nga ang oras, akala ang tagal lang 1 hour. So to our viewers, thank you for listening and for your time. Uh, the pandemic, let's just hope and pray that this everything will just pass. But most of all, let's stay healthy. No, I hope we have learned through the past 2 years that what is important is not the material things that we have, but the family that we live with and all our loved ones. And by that, we should take care of our health, because in doing so, even if we have contacted the coronavirus, the COVID-19, we will survive this if we stay healthy, always healthy.
Wow. Thank you, Doc. No? So health is wealth, and it's
Indeed.
important now that we take care of our health. And there is something there, no? The God gave us our body. God gave us, di ba, itong ating body to really enjoy life, no? So God said in His Word that I have come to give you a life that is abundant, and living a healthy life is an abundant life, so that we can have a quality life to spend with our loved ones and to do our mission, to do our calling, ano? So yung mga marami pong nanonood ngayon, Doc, ano, and they're thanking you. So Filma, if you know her, him, no? Thank you, Doc, and Coach Marife, no? So marami po silang natutunan. So Doc, maraming maraming salamat po for sharing your wisdom and your knowledge to us, no? So we'll see again later on sa backstage po. And thank you, no? Because you have given
Thank
us
you.
this opportunity. This is our first time to meet, but you said yes to this invitation, and this is the Heart of Life Coach Philippines via Think Talk broadcast, our channel, no? So to educate all the people about health is wealth, about when sickness matters, no? You know what? Sickness matters until it becomes a reality to your family, to yourself, 'di ba? Hindi natin iniisip yung sickness kung wala siya. But it becomes a
Yeah.
reality when we are hit with that sickness. So
Yes.
that's why the aim of this show is to really help all the people to understand the importance of taking care of health, to understand the that health is wealth. And sabi nga ni Doc, the ball is ours. It is in our hand, that it is our responsibility. It's no one's responsibility, not the government, no? So hindi ng kahit sino man ang may responsibility sa health natin, but it is us. So it begins now. no? So our health professionals are our partners. So yung ating mga doctors, they are our health partners, and this show is all about bridging the gap of the healthcare and the healthcare provider, the healthcare services, in to bridge that gap of healing and breaking the bias on the medical services. So once again, thank you, Doc Eric, ano? And of course, we would like also to invite you to watch the other show hosted here at Ting Talk Broadcast. So please follow, subscribe, and engage on our social media accounts at Ting Talk _TV on Twitter and on Instagram, and Ting Talk Broadcast on YouTube, and give us your review. And for partnership and collaboration, so please connect with Coach Roselle at 0917-586-1661. So see you again in the next episode of When Sickness Matters on May 15, that is a Sunday, 8 p.m., live here at Ting Talk Broadcast. And once again, this is Master Coach Hasmin. Coaches like us think and talk like this. Love, bam, boom. So this is us in the Philippines advancing life coaching worldwide. See you again next week.